This is All India Radio. In the program Insights, now we bring you a discussion on benefits of Ayushman Bharat scheme. The participants are Dr. R.S. Sharma, CEO, National Health Authority, and Aditi Tandon, journalist.
Ayushman Bharat Pradhan Mantri Jan Arogya Yojana has now entered its fourth year, and this has proved to be the most successful and the world's largest free and cashless health delivery scheme as far as secondary and tertiary hospitalization is concerned. It is also very important to note that the expansion of the program has also been comprehensive, with the government trying to include as many categories as possible and trying to also go beyond its mandated packages by including more and more health packages in the Ayushman Bharat scheme, and also recently by including transgenders for a range of surgeries for which a package is already being finalized by the National Health Authority. Dr. Sharma, how do you look back at 4 years? How satisfied are you with the performance of the program?
Well, the program started on 23rd of September 2018, and it is exactly 4 years we have completed. And I think we have progressed in this journey to a very large extent, because the first 1 crore beneficiaries hospitalizations took about 1.5 years, but the last 1 crore has taken just about 6 or 7 months. So essentially the speed has accelerated. Thus far we have done about 3.9 crore hospitalizations, amounting to 45,000 crores approximately. And of course, we have issued 19 crore Ayushman cards to the family which are beneficiaries of Pradhan Mantri Jan Arogya Yojana. So I think it is doing quite well, and the number of packages have increased to about 2,000. The rates of the packages have also been rationalized to a very significant extent.
Right. Going forward, Dr. Sharma, since authorized hospital admissions that have been included under this 4-year program already have been more than 45,000 crore, which looks very encouraging, and you obviously plan to expand this. What, according to you, is your biggest challenge going forward? Because some private hospitals have concerns with respect to rates of the packages. Are you in touch with them?
Certainly are in touch with them. In fact, the health benefit package construct and their rate determination is done in consultation with the private sector, public sector, all state governments. So it's basically a consultative exercise. So that is something which we keep on improving as we go along. As you will understand, the cost of living and other kinds of things also change. So we are sort of frequently changing our rates at given intervals. So that is one part. And I don't think really people do have such major concerns, because please also remember that the scale is also very large. So there is always a trade-off between the cost and the volume. So if somebody who is a customer who provides a lot of volumes of treatments to you, then obviously you have to give some discount to that customer. So in some sense, the rates are a little below the market rates, but not too much below. That's one part. Secondly, we also have challenge of these hospitals, because while we try to empanel hospitals in remote rural areas, there are certain districts where the number of the hospitals are not there who fulfill the criteria of empanelment. We try to kind of even relax the criteria of empanelment there. So the whole idea is that people don't have to travel too much to get the treatment. Third is sometimes, there are delays in reimbursement of the claims from the hospitals, and we keep on taking up with these states. So while we have the overall mandate that we should clear the bills within 15 days, there are situations in these states where this does take a little more than 15 days. So we also always try to ensure that we stick to a timeline. So essentially the idea is the rates, the disbursement speed, and other concerns of the hospitals must be taken care of. So we are working with our stakeholders to sort of remove these difficulties. We have taken a number of steps, like, for example, green payments, green channel as we call it. So essentially, when you submit a claim, 50% of that claim is immediately paid, even without examination of that claim, because we have a continuing relationship with the hospital. And so therefore, we pay that. That actually, in some sense, addresses their cash flow problem. So these are some of the things which we have done.
Right. So you already have about 28,396 empaneled hospitals, and as you said, you are in touch with all stakeholders to take this forward. Dr. Sharma, what are the packages that dominate Pradhan Mantri Jan Arogya Yojana?
The whole scheme is for hospitalization, which means the secondary and tertiary care is basically the area which we cover. And in that particular respect, medical oncology followed by orthopedics, these are the two packages which are in higher demand under tertiary care specialties, whereas general medicine followed by general surgery are in higher demand under secondary care specialties. And Kerala actually has shown the highest hospital admissions, which is actually 25,252 admissions per lakh eligible beneficiaries. So that's also a very significant number. Actually, it is not 25,000. I think it's about per 10 lakh beneficiaries. So it is 2.5%, so to say, is the overall patient. So it's quite significant. The health-seeking behavior is the best in the country.
Absolutely. Kerala's health-seeking behavior has been a very important example through recent outbreaks also. Dr. Sharma, are all states and UTs now on board with respect to PMJAY, or is there still problem with some states coming on board?
No, we have 33 states and UTs on board, and that actually excludes 3, which is the Delhi, West and Odisha. These 3 states are not on the PMJY. We have been kind of pursuing them, and we have been talking to them, because ultimately the value add which PMJY provides, one is there is a common technology platform which actually ensures that there are no duplications and no fraudulent part is not there. Secondly, we have a national anti-fraud unit which works on this technology platform. And third is the portability, which means the person from Bihar can take admission in let's say, Calcutta or in Delhi or in Madras. Essentially because this Ayushman Bharat PMJY, the database is essentially portable database in the sense that they can be accessed from anywhere. So that is the third very, very important advantage. And of course, the policy making. We do a lot of research while coming up with the health benefit package. So I think almost everybody except the 3 states which I mentioned to you are on the platform of the National Health Authority.
Right. The National Health Authority recently struck a landmark memorandum of understanding with the Social Justice Ministry to also cover transgender persons and also prepare a package for them for sex reassignment surgeries. Where have you reached with that, Dr. Sharma?
So, as you said, apart from the treatment packages covered under the PMJY, we have about 50 more packages that have been defined specifically for the transgender community. And of course, there is a database of the transgender community which the MOSJE maintains, because ultimately beneficiary database is their sort of area. So that's what we do. The packages include the sex reassignment surgery, and the construct of the package include genital surgeries, hormone therapy, laser therapy, follow-up packages, procedures to ensure the continuum of care for transgenders. We are going on this technology platform. We are onboarding them. We are in the process of onboarding the entire database of the transgender to essentially make the entire range of services available to them.
Right. A lot of people would be interested in knowing whether there is any further plan to expand the ambit of Pradhan Mantri Jan Arogya Yojana. Already you are covering 10 crore families mentioned in the socio-economic caste census, but is there any thinking to go beyond that?
Well, that is not really within the purview of the National Health Authority. I think as and when the government takes a decision in this regard, we will implement it. But let me share with you the fact that the National Health Authority's technology platform, because we process the entire set of claims under the Ayushman Bharat PMJY in a paperless manner. So there's a technology workflow where the hospital submits the claim and then the claim passes through various stages of examination and finally it is paid to the hospital in their accounts. So that kind of process is very well laid out. And that is now being utilized with a number of other schemes which we call convergence schemes. So for example, the central government health scheme, CGHS, for retired government employees is now on the Ayushman Bharat NHA platform. So we are having a lot of convergence schemes.
Another very important pillar of Ayushman Bharat mission as a whole, Dr. Sharma, which also you are spearheading, is the digital mission, the digital health mission. And we did hear in Parliament recently, the government gave some replies saying that a certain number of health IDs had already been generated. What is your experience there?
Now, you see, as you know, the ABDM, basically the National Digital Health Mission was announced by the Honorable Prime Minister on 15th of August 2020. And then, as per his direction, in 6 UTs, Union Territories, we started a pilot. And that pilot basically has done quite well. And then encompassing that, the Honorable Prime Minister launched the Ayushman Bharat Digital Mission on 27th of September last year. Now in this 1 year, we have actually completed the work of technology, which is the building blocks of Ayushman Bharat Digital Mission, which consists of the personal health record, the Ayushman Bharat health account number, the health facilities registry, the health professional registry, the drug registry. All these, components are interoperable, teleconsultation. All these components have been completed. And now we are accelerating the, generation of Ayushman Bharat health account number. Thus far, we have done about 24.33 crore Ayushman ABHA accounts we have created. Then we are now linking the health records, and we have done about 1 crore of health records have been linked at a very fast pace of about 500,000 per day. And therefore, what we are creating is actually a digital ecosystem for the delivery of health services.
So you have actually started issuing IDs in the 6 UTs that you mentioned.
No, the entire country now. And actually you can see on dashboard.abdm.gov.in, which is our portal. You can see the real-time progress of these ABHA IDs and the health facilities and the health professional registry. That is the architectural principle which we are employing in the Ayushman Bharat Digital Mission.
Dr. Sharma, by when do you plan to cover the entire country with respect to health IDs and the digital health mission? Is there any target date?
Well, I can't really give a target because it's a continuing stuff. It's not something that once you give the IDs will not serve any purpose unless you start linking the health record and unless people start building their, longitudinal health history. And that is actually something which people, hospitals, laboratories, pharmacies, everybody has to work together. Doctors, they have to work together to construct that. So we are creating awareness. We are providing technological, financial, and also regulatory kind of, levers to ensure that this process is accelerated. But at this point in time, I cannot give you any timelines of completion.
Right. Dr. Sharma, one issue that you have always been saying and talking about has been the privacy under the Ayushman Bharat Digital Health Mission, and NHA has actually assured citizens that their health records will remain private and secret. How do you ensure that when you create an account?
We call it the federated data architecture. Now, what it actually means is that the Ayushman Bharat Digital Mission does not seek to aggregate or collect at one place all the health accounts of the people. The health accounts of the people remain wherever they are created. So, for example, if you visited an Apollo hospital and the doctor gave prescription and some tests were done, those records will remain with the Apollo hospital. What the Ayushman Bharat Digital Mission ensures is that your records are linked with your Ayushman Bharat health account, and therefore you will be able to access them as and when you want to access them or as and when you want to share them. So basically, the control of the records is not with anybody else except the patient himself. And that's the architecture.
Dr. Sharma, do you have any estimation of how many, laboratories, hospitals have you actually integrated to create this kind of a digital health infrastructure? Do you have any estimation? What is the scale of this effort?
Not only we have the estimation, we have the exact figures, and as I explained to you, you can go to Ayushman Bharat Digital Mission's dashboard, and that dashboard basically give you, in fact, total number of hospitals linked with it. So, for example, we have the 158,459 hospitals which are verified facilities on the health facility registry. We have 88,000 health professionals, and we actually give who has created ABHA, which hospital has created ABHA, which state has created ABHA, where these hospitals, the professionals belong. So everything is actually given in this dashboard. This data is a real-time data. So we have created a methodology whereby anyone who creates the Ayushman Bharat health account, that account is basically just, we don't have the information about that account, but we just collect that number that yes, this number has been created. So that when we have the aggregated data which are anonymized, which are not related to any specific person.
That sounds like a humongous effort, Dr. Sharma. Thanks for your time.
Thank you very much, Aditi.
You were listening to a discussion on benefits of Ayushman Bharat scheme. The participants were Dr. R.S. Sharma, CEO, National Health Authority, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsdtalks@gmail.com.